Welcome to the conference session titled Emotional and Health Impact of Caregiving. Thank you for joining us. My name is Lee Clark, Director of Patient Services, and I'll be moderating the presentation today. As we get started, I'd like to recognize the generous support of the corporate sponsors and the generous support of our patients, families, and caregivers for supporting the conference today. During the presentation, there will be some interactive questions. So we welcome you to submit your answers using the Q&A icon in the engagement panel on your right. You'll also use this feature to submit your comments or your questions, which Jane will answer at the end of the session. We will do our best to get to everyone's questions today. When asking your questions, I do ask that you do two things to help me manage the incoming question. Submit your entire question all at the same time. Please do not share private health information in your question. Our expert speaker can't answer any specific questions related to your personal health care. Our specialist today is Jane Hamilton. Jane has been a nurse for over 40 years and a family caregiver for 20. She's also the founder of Partners on the Path, which provides caregiver support programs to businesses and nonprofits, healthcare, and faith-based organizations. Jane is an expert on managing caregiver stress, building resilience, and preventing compassion fatigue. She has created evidence-based resources that both help family and professional caregivers remain healthy, compassionate, effective, and productive. With all of that said, it's my pleasure to welcome Jane. Thank you for joining us, Jane.
Well, thank you for that lovely introduction, Lee, and I am really delighted to be with you all today. I welcome you to our session, and we are going to talk today about caregivers and caregiving. We have three objectives, and what I want to do is to show you what our agenda is going to focus on. First of all, we're going to talk about who is a caregiver and what is it that caregivers do. I'm going to talk with you also about the concept of self-identifying. Many times we as caregivers just do what we're doing and don't think of ourselves as caregivers. And we're going to talk about why that is an issue and why it's a good idea to think of yourself as a caregiver if in fact that's what you do. We're going to also talk about the impact of caregiving on caregivers' physical health as well as on our emotional health. And we're going to close with some discussion about what are some practical strategies that you as a caregiver can use to help preserve your own health and well-being and also preserve the quality of care that you provide to your loved ones. And as Lee mentioned, we want to hear from you. I've got lots of things to say that I've put together for you, but I think it's always much more interesting and fun when other people join in the conversation. So we're going to ask you to type into your chat box responses to some of the questions and get involved. And if you have a question, to put it out there, and Lee will help me to hear that question and respond to it. So what I want to start with is asking you the question, are you a caregiver? And if you are a caregiver, can you type into the chat box who it is you care for? Not a person's name, but your spouse, your child, your parent, your sibling, a friend, a neighbor. Can you give us some information about that, please? And type that in. And what we're going to do is we're going to look at this idea of, am I a caregiver? And when you signed on, Lee has told me that there are 4 assessments which I put together for people who participate in this program. And the first one is a question about, am I a caregiver? And there are 4 tasks that most caregivers do. Some do them more often than others, and then there are others that are not done. And so if you're wondering, or if somebody else is wondering, are you a caregiver? There is this tool that you could, an assessment question that you could complete to see if in fact that applies to you. And so we're gonna, I will move away from that now and move back to the slide, and we're going to talk a little bit about who is a caregiver.
Jane,
Yes.
we've had a few responses
Good.
to your question. So we have folks who are caring for a spouse, husband, and wife. We have children of adult patients. We have someone who's caring for their grandmother. We have somebody who's caring for a pediatric patient, someone who's caring for a friend, and someone who's actually caring for a friend who is a nurse who has been diagnosed.
So
thank you to everyone.
The patient is a nurse?
The patient is a nurse, yes.
Okay. Well, thank you so much for chatting. When we're sitting in a room together in a seminar, I can look at you and you can look at me, and we get into interaction online. This is, I think, our best option is to add to the chat. So we have caregivers of people across the age life cycle spectrum of ages, from a pediatric patient to a more elderly person. So what we see in this cross section of the people who are part of our webinar today is that we're caring as a family caregiver, not as, and what we're talking about today is not in a professional capacity where I'm employed or a volunteer at a hospice, but I am somebody who is caring for a family member, either family by blood, somebody who is my grandparent or my child or my sibling, but it can be family by choice. It can be my neighbor. It could be a friend of mine who I feel very close to. And when we talk about family caregivers, we're talking about people who are can be any age, any race, any gender, any socioeconomic group. Caregiving is something that goes across society. And our former First Lady, Rosalind Carter, has a famous quote about caregivers. She says, there are only 4 kinds of people in the world: those who are caregivers, those who have been caregivers, those who will be caregivers, or those who will need caregiving. And she basically says this is a universal experience because we care about people who are in our family or who are our friends. And what do we do as a caregiver? We provide for the needs of somebody who may be ill, disabled, elderly, or a special needs child. What we do can be highly technical, or it can be very simply supportive, like preparing a meal. So there's a wide range in the kinds of things that we do. But one of the things that is really shared by all of us as caregivers is that we're pretty much on our own. We're not affiliated with X healthcare system or a formal organization. We are not being paid for what we do when we're a caregiver. And oftentimes we have little or no training and no experience. We're cast into it by virtue of the fact that we love this person or see their need and have a sense that this is some need to which I would want to respond. The average length of caregiving, the studies have shown, is 4.6 years. There are many caregivers who provide care for longer than 4.5 years, but what we can see is that this is not a one and done kind of thing. It is something that we experience over time, and by virtue of that longer time experience, caregiving can be stressful. What we also know, there's another famous quote that I found, the author is unknown, but what they said is, when you've seen one caregiver, you've seen one caregiver. So Rosalind Carter talks about the universality of it. Everybody's going to have caregiving or in their life sometime, but the experience of caregiving is uniquely personal. The individual who you care for, what their health situation is, what your family situation is, what your financial situation, your own as a caregiver, your own health situation is, and how the disease or condition progresses over time. There are so many variables that change. And so when you think of caregiving, and I want you to think about this as we talk today, that it is a universal experience, but it is uniquely personal to you and to your care receiver. And so what you do to take care of yourself has to be done with that in mind. So I'm going to talk also with you about, what do caregivers do? And there was in your packet of materials a handout that is called "Why Am I So Stressed?" Because what caregivers do, by virtue of the fact that it's over 4.5 years on average, or by virtue of the fact that there are challenges to how you feel about doing what you do, that caregiving is stressful. And we're going to look at what it is that we do as caregivers, uniquely personal. Not everybody does all the same tasks, and not everybody experiences the same challenges. But what we know about caregivers is that, first of all, there are basically 4 different kinds of tasks that we provide physical care. We feed and bathe and dress and groom the care receiver, and perhaps help them with walking or getting to the bathroom, and maybe provide some necessary medical or nursing kinds of tasks, like changing dressings or providing medications, or doing wound care for some people. The second set of tasks has to do with personal affairs. I manage the medication, the finances, the legal, insurance, or care coordination issues that the care receiver has. Caregiving tasks also involve household affairs, like cooking and cleaning, shopping, laundering, doing home repairs, the kinds of things that keep a household going. And you know, if the mother in the household is not well, others in the household do some of these tasks. So household affairs. And finally, caregivers provide emotional or social support. When caregivers focus beyond what the tasks are, they can look at what are the challenges. And these are not so much the actual doing of caregiving as what the experience is internally, what the sense that I, as a uniquely, a person in a unique situation, feel. So not every caregiver will face the same challenges, but these are common ones that one can encounter. First of all, and during our COVID era, we find that the challenges as caregivers are unprecedented. I'm juggling an increasing set of responsibilities without the usual sources of support either from school or from elder care or from child care providers. And oftentimes, because the usual support isn't there, more responsibility falls on my shoulders. And so one of the challenges that caregivers experience is that I feel unprepared. I'm responsible for doing all these tasks, but I don't have the training and the experience to be able to handle the situation with a great sense of comfort. Also, it's challenging sometimes because caregiving is unpredictable. I don't know and have no control over when emergencies or crises may arise. And I'm caught off guard sometime, and it makes it a difficult situation. Also, caregiving is challenging because sometimes I am totally overloaded with an unrealistic set of responsibilities. Too many things to do added on top of my other work and home and family responsibilities. My to-do list is way too long, and I'm juggling so many things that I can't stop. Also, caregivers are challenged by feeling unsupported. We usually look for care partners in our family, or in terms of other friends who may come in and help us, or in terms of professional support. But sometimes caregivers feel unsupported because folks don't come in and actually help them out. And sometimes it's hard for caregivers to get a break. When unsupported, caregivers can feel very isolated and alone and find it difficult to find time for self-care. Two more things I think that are common challenges for caregivers are the feeling of being upset. Underlying the experience of caregiving is often a sense of loss. When we see our loved one becoming ill and dealing with difficult health situations, there is a sense that the life that we used to know, the level of health that my loved one used to have, is slipping away. And I can experience a sense of grief and all of the emotions that go with it: the sadness, the anger, the denial, the sense of guilt, the sadness, a sense of depression, fear about what's going to happen in the future. And oftentimes, a caregiver can feel upset about the new normal. I don't like the way it is. I want to be able to go back to the way it used to be. And when we realize that there is no going back, it's a very upsetting, can be a very upsetting thing. And finally, we know that caregiving is oftentimes puts a caregiver in a financial bind. And so on average, caregivers can spend about $10,000 a year on caregiving expenses, and this can have a significant impact on the caregiver's financial health. So when we think of ourselves, when you think of yourself as a caregiver, remember these tasks and these challenges, and recognize that these are the things that generate that sense of stress in your life. So here's a question, type into the chat. What are the tasks? What's the major task that you have to do? The physical, personal, household, or emotional support? And what is one of the things that you find to be a big challenge for you as a caregiver? Let us know in the chat box. And Lee, tell me what you're seeing.
Hang on one moment. Right now, there's not anything at the moment, but if anything comes up, Jane, I'll let you know.
Okay, that sounds good. That sounds good. So Let me go back to, let's see, am I on my slides? Is that where we are right now?
Yes.
Okay, so now I think I have gone. Okay, so I talked earlier about, caregivers do so many things, and oftentimes I hear caregivers say, "Well, I'm not a caregiver. I'm just her daughter," or I'm not a caregiver. I'm his wife, and this is what family members do. And so if you find yourself saying, "I'm not a caregiver, I just," what I want to highlight for all of us is that there is value for you as the caregiver in claiming this caregiver role. It's important to identify if you are actually providing care. And why don't we? I think one of the reasons I've mentioned is this idea of traditional roles. I'm in a family. I'm a daughter. I'm a granddaughter. I'm a mother. I'm a sister. I'm a wife. So this is what I do, and so I overlook my role as caregiver because I'm in other roles. And so that's one of the reasons we have varying expectations. Oh, well, I expect myself to do all this stuff if I'm married to him. We also diminish the impact on ourselves. I'm strong, I'm healthy. He's the one that's not well. So I've got enough energy, I can do it. I've always had a lot of energy, I can do it. And we diminish the fact that over time, being exposed to additional stress on top of the other challenges can deplete the energy that we have. And I think sometimes, based on our varying experiences, we may have care partners who are solid, who are really there with us. And so if we have a great support system, if we have 5 siblings who all come in and contribute and are there in support of each other to take care of mom, my care partners may be lifting me up. And I may not really have a sense that I'm challenged too much. And actually, some studies have been done and on spousal caregivers. In one study, 44% of spouses reported no strain in caregiving. It's just something that they wanted to do. And so the level of stress will vary. That's that uniquely personal piece of it. Know that there is stress, but it may not tip you over into being burdened or strained in an intense sort of way. But there's a second reason why caregivers don't self-identify, and it's because of the care system. Healthcare providers, the long-term care or social support system, the rehab, the long-term care facilities, the hospital staff prioritize meeting patients' needs. That's what they're paid to do. That's what Medicare and Medicaid and the health insurers pay them for. And the healthcare system is not reimbursed for caring for caregivers. The insurers pay them to take good care of your loved ones who are ill. So their major focus is on the patient, and so as a result, they may not see that you as a caregiver are struggling. So I have this picture here on the slide of the Titanic sailing towards the iceberg. And like you as a caregiver may be sailing towards some stress-related illness because you're out of balance. Unfortunately, the people on the deck of the Titanic are not seeing that iceberg, and some professionals may not be aware of the challenges that you face and consequently may not alert you to them or offer you support. And as a matter of fact, in one study that was just done on caregivers in the US, only 29% of caregivers report that healthcare providers asked them if they had any needs in terms of providing care, and even smaller number, 13%, reported that any kind of healthcare professional asked them about what kind of needs they have to take care of themselves. So it's largely invisible in the healthcare setting, but that doesn't mean that we as caregivers don't have issues. So let's move beyond this issue of self-identifying and talk a bit about what caregivers do. No, excuse me, I've lost my way. Have you ever lost your way? We've talked about what caregivers do. Let's talk about what our doing does to us, how we are impacted. And there has been a tremendous number of studies, years of research have identified that caregiving can impact on both the physical and the mental health of caregivers. So let's first of all look at the physical consequences. On average, again, I said 4.6 years, and a third of caregivers spend more than 5 years providing care. The stress of caregiving then is a chronic source of stress, and it erodes the immune system. 60% of caregivers report moderate to significant decline in their own health. And caregivers are at greater risk of minor ailments, things like, acid reflux or headaches or back strain. And they are twice as likely as non-caregivers to have significant chronic conditions like heart disease, diabetes, arthritis, or even cancer. Caregiver stress, studies have shown, can take as many as 10 years off the life of some caregivers. And studies have shown that older adult caregivers are at risk for falls. So we need to be conscious of injuries. And some caregivers get injuries as a result of providing care, like back strain. As the stress of caregiving increases, caregivers often report sleep disturbances increasing. This is an under-recognized problem, and it's caused by the actual interruption of sleep by taking care of the needs of the care receiver, having to get up in the middle of the night and then not being able to get back to sleep, or being upset and having worries disturb your sleep. And this kind of sleep disturbance is associated with negative health outcomes. Stress predisposes caregivers to weight change, you might have noticed, and it is most significant in caregivers who are highly burdened and stressed by their caregiving. Physiologically, that stress raises cortisol levels in the blood, which leads to increased insulin resistance and an increase in weight. But on the other side of it, some caregivers lose weight because they don't eat as well, and with improper nutrition, lose weight. And what we have found in recent studies is that the health differences I've just described are more pronounced in millennial caregivers than they are for caregivers who are either of the Gen X group or baby boomer group or communities of color. What we also know, and let's shift now to how caregiving impacts the emotional well-being of caregivers. We know from studies that between 40 and 70% of caregivers report moderate to severe depression. A third report moderate to severe anxiety. And caregivers use prescriptions, medications for depression or anxiety at 2 to 3 times the rate of the general population. Nearly a quarter of all caregivers are reporting a sense of loneliness. Caregiving can be isolating in that caregivers are carrying not only task burdens, but some of those emotional challenges that we mentioned earlier. And we know that in those who describe feeling alone, a remarkable 72% report high levels of emotional distress. So there's a real correlation between loneliness and emotional distress. And what we also know is that family conflict can commonly occur within a family that is facing caregiving challenges, disagreements about old family issues, about who provides care and what kind of care and how to handle finances are some of the common issues that arise. Researchers have developed something called the caregiver burden scale. And I'm going to show you in one of our here we go. So you should be seeing now the burden scale. This is one of many, but researchers have developed a series of questions that caregivers can answer, and can, by tallying them up, get some valid feedback to let you know if your health is at risk. And so I encourage you to go to this burden scale after the session is over and check out your own level of burden, because the more you know about your own health, the more readily you will be able to take action to take care of your own well-being. So negative physical and emotional consequences, however, we need to understand are not inevitable. As I mentioned earlier, 44% of spousal caregivers report no strain. And many caregivers don't report high levels of stress. In fact, they talk about coping successfully, getting positive psychological benefits from providing care. And so we don't need to automatically assume I'm a caregiver, I'm going to have some bad stress, but to be aware of it is the idea. In high burden or strained caregiving, the health of caregivers, both physical and emotional, is impacted. And what we know is that healthy self-care can help us preserve our health and well-being. So let's talk a little bit about how it is that we can protect our physical and mental health and build resilience. Studies have shown that healthy self-care is the most effective way to build our resilience, our ability to handle adversity. That's what resilience is. It's the ability, the strength and the stamina to persevere when life is challenging. One researcher described it as struggling well with adversity. Resilience is being able to bounce back from setbacks, or even sometimes to bounce forward, and as some of the caregivers have identified, to be able to do better and more and be able to surmount the challenges in front of us. And so what is healthy self-care? I'd like to spend a few moments with you talking about that. And I have in one of the handouts outlined what healthy self-care practices are. And so I'm going to talk with you a little bit about the physical, emotional, mental, social, spiritual, work-related, and problem-solving action that you can take. I encourage you to go to this tool and to look at what it is that you currently are doing to take care of your own health and well-being. And the first self-care practice really is all about looking at holistically looking at your life, that you and I as living human beings are made up of these interrelated and interdependent parts. I'm a physical being. I have emotions. I have a social interactive part of myself where I like to be with other people. I have a deeper spiritual component. I have an intellectual or cognitive part of my life. I am occupational. I have work that I do, whether it's caregiving or employment or housework. There's a financial part to myself. And I also have challenges and problems that if I take care of them, I will feel better. And so this model, this holistic model, says that I am, all of these parts make me who I am. And if I take care of any one of those parts of myself, it will have an impact on my whole sense of health and well-being. So thinking about if I'm emotionally upset, if I go out physically and take a walk or take a nap or take a rest, that can emotionally calm me down. If I'm upset, if I go and spend some time with my friends socially, that can help me feel better. You understand what I'm saying? And so when you care for any part of yourself, it feeds your whole self. And so what I want to emphasize for each of us is that we're whole human beings, and self-care of any part feeds our whole sense of health and well-being. What I want to emphasize too is that self-care fills back our energy. Caregiving is often like a pot of soup, warm, nourishing, and we give our care to people. We spoon out, we ladle out this warm, delicious, nourishing soup, and we give to others. But if we continue to give without refilling our soup pot, pretty soon it will be empty. And so when you're a caregiver, it's beautiful to give to others, but it's also very wise and imperative that each of us gives back to ourselves the energy that we need to keep on caring. So these are the things I'm suggesting that you should do to care for yourself. But my second self-care practice is what we shouldn't do. We should avoid stress numbing. The pictures on this slide sort of illustrate shopping sprees and drinking and eating a bunch of junk food and spending a whole lot of time on a screen. When we indulge in these pleasures as our approach of choice for caregiving, for stress, to relieve caregiving stress, we're really not taking care of ourselves in a healthy way. Stress numbing behaviors such as these deaden the pain, relieve some of the discomfort, distract us from the things about which we're worried, but done over time to the exclusion of healthy self-care can cause physical and emotional problems, financial problems, relational problems for us. My mother used to say to me, Jane, have everything in moderation. So, buying myself a new shirt, or having a glass of wine with a friend, or a little bit of ice cream, or watching a TV show, all of those things in moderation are fine. But in excess, it can cause problems rather than solve them. So I would encourage you to look at what your choices are and make sure that, along with the healthy self-care practices, that you avoid stress numbing as a serious and regular approach to your stress. And the last self-care practice that I would like to recommend is for each of us to actually commit to self-care. Not when I get around to it, oh, maybe, I don't have enough time for that, everything else is more important. No, what I'm suggesting is that we need, as caregivers, to recognize that we're human beings, we're living, organic, and not machines. We don't plug ourselves into the electric socket to get the energy to go. We have to do things organically, personally, to fill ourselves back up. And so self-care is a replenishing and health promoting strategy. So what I like to think about in terms of moving myself towards practicing self-care regularly is these three words: committing, by admitting my need for self-care, that I'm stressed sometimes, and identifying when I am stressed, that I admit that I need to do something for myself. The second part of practicing self-care is really permitting myself, saying it's not selfish. I don't have to feel guilty for taking some time off. We sometimes don't give ourselves permission, and my suggestion is to reframe self-care. If you're thinking along the lines of selfishness, reframe it as health promotion. And the reason I have this picture on the slide of the little children brushing their teeth is that healthy self-care is like dental care. You have a toothbrush and you have the toothpaste, and you use that, and you do this every day, and maybe sometimes floss. Little teeny things that you do every single day, year after year after year, have added up to dental health. And when we don't do those little things day after day after day, as people in various places around the world are not able to do, they don't have dental health. So it's the little things that add up to ongoing health. And so for you and me, when we're caregiving, remembering that the little things I do to nurture myself, having a cup of tea, sitting and taking a moment to breathe deeply, those little things can help me to get through. And beyond admitting and permitting, then finally committing, making a plan and following through. Okay, this week I am going to take a walk 3 times in the afternoon. I am going to spend 15 minutes 2 days this week practicing meditation, making a list of things that I will do, one thing today, whatever the list might be, put it on a piece of paper and commit to it. Recognize that if you don't put you on your to-do list, nobody else will do it. And recognize, again, the restorative effect of self-care you are refilling your soup pot, and you can't give what you don't have. And so I urge you to admit, permit, and commit yourself to self-care. And so now we're getting to the close of our session today. And I would just like to remind you of the 4 tools that we have used throughout this session. A self-assessment question about, am I a caregiver, and what are the things that I'm doing that cause me stress? A burden scale to evaluate if your health is at risk, and a set of healthy self-care strategies that can guide you into actions that will help to maintain your health and your well-being. So during the webinar today, what we've talked about is the ways that caregiving can impact both the physical and the mental health of caregivers. We've outlined self-care practices that can preserve your well-being, and I've given you 4 tools that you can use. So what I'd like to do is, Lee, I'm going to ask for people to type in the chat box. Can you write one thing that you will do to care for yourself in the next few days? One thing that you'll do for you. I'm going to give you a second to do this. And Lee, I'd like you to tell me what are some of the things that are coming through in the chat box. One thing you'll do.
Well, Jane, while we're waiting for that, we did have some responses to when you had asked earlier about what were some of the challenges.
Oh, good.
So I'll go ahead and let you know about those while we're waiting. So one of the challenges was juggling work and caregiving.
Oh, huge, huge.
One of the other challenges was watching my loved one fading.
Yes.
And another was, one of our challenges is some of our caregiving partners are not proactive. They need to be asked for help.
That's right. So let's start with the not proactive care partners. So one of the challenges for caregivers is to have care partners who are less than effective. And so maybe one of your self-care strategies would be to sit with them and to talk about what your needs are. If that conversation doesn't help, and I go back to my own personal caregiving experience, there was somebody in my family who was AWOL. They just never, in all the years that we went through this, showed up, if you will. And so if that is the case, the image that I have is, if I want milk from the refrigerator, and there's nothing in the milk carton, to wring my hands and get upset about nothing being in the milk carton is not going to change what's in the milk carton. I have to go out and get another carton of milk. So for us as caregivers, when those care partners are unable to or unwilling to deliver, the thought process might be, to whom can I turn? Where else can I go for the support that I need? And sometimes to just let that go is the only solution. Not an easy one. It took me years to get to that one, and hopefully that will be of use. In terms of working and caregiving, there is a tremendous amount of interest these days about that issue, and an awareness that the average length of time people spend caregiving per week is something like 28 hours per week. Pre-COVID, it was 21 hours on average. So caregiving is like a part-time job at best. And in terms of hours and the amount of energy being spent, to let people in your workplace know, that's a question each of us has to approach individually, because you know the people in your workforce, and I don't. But many caregivers are employed while also being a caregiver. So it brings to the fore the importance of negotiating with care partners and developing a network of care partners to help you out. What was the third one, Lee?
Watching my loved one fade.
Yes, yes. Be aware of the fact that the undercurrent of caregiving, particularly in situations like each of you is in, there is a tremendous amount of grief and loss, because who the person was and what our lives were pre this situation is gone. It is no longer, and it will often, in many ways, it won't come back. And so we must focus on and recognize that there is an undercurrent of grief and loss, and it's that's the topic for another seminar. But find a way to go through that sense of loss. Is there somebody with whom you can talk about your feelings of loss? A clergy person, a friend, a neighbor, a family member, a therapist, and caregiver support groups often address those issues as well. But that is a major, intangible, but very powerful aspect of caregiving. Yeah.
Jane, we've had some responses for what can caregivers do
Oh,
for
good. What are you gonna
themselves.
do?
So the first one is go shopping for myself.
Oh, give yourself a treat.
Second we have is take a 15-minute drive by myself for some quiet time.
Oh, yes. Are you in a place, this person who's going to take the 15-minute drive, are you in a place that has beautiful fall leaves? I know that for me, savoring the beauty of nature, whether I'm walking or driving, is a self-care practice. So look for beauty as you drive in the silence.
The next one says, ask my spouse, who is the patient, to watch a movie once a week together. This is something that we did while we were dating.
Wonderful. And to articulate your own need, and to ask the person who is your care receiver, the patient, to say to him or her, you can do something for me, and it creates a mutuality, which is very empowering, I think, within the context, and affirming in the context of a couple.
Another one we have is take a walk each morning before we start our day.
Yeah. I started walking when I was in my caregiving experience, and it's not only mentally good, physically it's good. It helps with sleep, it helps with digestion, it helps with weight. Taking a walk is it's a low stress but a high reward self-care practice.
The next one says FaceTime with my girlfriends a few times a week.
And that FaceTime, you see their face, so you get the joy of the conversation, but you also get sort of the interaction of of being face to face, which I think is good for us as human beings. I miss not being able to see all of you who are participants this afternoon.
And Jane, those were the responses we had so far.
Well, thank you. Well, we're getting to the end here, and my question to you, Lee, is there a program evaluation?
Yes. So at the end, if all the participants will look on the right-hand side of their screen, underneath the Q&A button is a survey button. So everyone will be able to take a post-event survey.
Wonderful. And so we would appreciate your completing that survey. And I would like to say in closing, first of all, thank you for participating this afternoon. From my own personal experience, I know that caregiving is some of the most meaningful, has been some of the most meaningful experiences in my life, but it's certainly was a challenge to me. And I am speaking to you today because I learned the importance of self-care as I walked the journey of my own caregiving experience. And so I want to remind you that caregiving impacts our emotional and physical health. And I and Lee and all of the people at AAMDS, everyone wishes you well, and we encourage you to care for yourself just as well as you care for your loved one. Thank you very much for joining us, and I hope you enjoy the rest of the conference. Thank you.
Jane, we have two questions, if it would be okay for
Sure,
you to
absolutely.
answer.
Yes.
Can you explain a little bit about what is caregiver burnout?
Okay, caregiver burnout, that is sort of a general term that people use when describing a person who is a caregiver who has given and given and given, and they're over the line, they're spent, they're emotionally or physically spent as a result of their caregiving experience. And so the positive aspect of it, the sense of joy, the sense of pride, the sense of accomplishment is sort of lost. And when somebody is experiencing burnout, they are just going through the motions if they're able to do it at all. And sometimes burnout gets a caregiver to a point where they can't do it anymore. And it has an impact on caregiver well-being. So if you're thinking that you have burnout, check that caregiver burden scale. That kind of ties to that experience, and find ways to restore your own balance, because caregivers are burned out because they're out of balance. They have given and given and given, and there's not much left in the bucket.
Are there some early signs that caregivers can look for, or those around caregivers maybe can notice that the primary caregiver is starting to reach the point of overload? Yes. Are there some early signs and symptoms that anyone would be able to recognize?
Yes, that's a great question. And this is what I want to highlight is that, you know, that self-care checklist that I showed you. Let me pull it back up here. Here we go. Are you seeing the self-care checklist right now, Lee?
Yes.
Okay, so this self-care checklist is set up related to the holistic view of the caregiver. We have a physical part, an emotional part, a mental, a social, a spiritual, an occupational, and a mental problem solving. So any sign of stress in any of these areas of your life are warning signals. When you can't sleep, when you are withdrawing, so physically, when you have a stomach ache, and when you have indigestion, and when your weight starts to go up, and when you have backaches or you're strained emotionally, when you're crying instead of being able to cope with something, when you're emotionally flat and you don't feel anything, or when you fly off the handle, or when you feel emotions so intensely that it's way out of proportion, or mentally, if you're forgetting things, or if you're going over and over and over something in your mind and you can't get out of it, or mentally, if you can't follow a task anymore, or socially, if you're withdrawing, or if you just don't get any pleasure in the usual things that give you joy, or spiritually, if you feel dead, or if you're spiritually dead, or if you're mad at God, or if your church services that you used to go to don't speak to you anymore, or occupationally, if you're unable to accomplish stuff at work, if you hate your work now, if you where you used to love it, if you can't think things through in terms of being able to do your work, or in problem solving, if you're stuck, you can't think of anything. These are all stress symptoms in these areas of life. And those stress symptoms are the warning signals. They're like a bell clanging in the background saying, pay attention, you're stressed, you got to do something. And so look for the signs of stress in all of these areas on this sheet. And the flip side of it is do something to nurture all these areas to help you handle your stress and avoid burnout.
Thank you so much, Jane, for all of this wonderful information for caregivers. They are the unsung heroes in the patient journey, and it's so important that caregivers take care of themselves as well. So thank you so much for all of this wonderful information. And if you'd like to watch this session again at a later time, it will be available on the conference platform within the next hour by accessing the session and clicking replay, or by navigating the on-demand tab in the platform hub. If you have any additional questions, please feel free to send it to us at any time in 3 ways. Send an email to help@aamds.org, call our helpline at 800-747-2820 extension 2, or submit your question to our Facebook page. There's still time to visit our exhibit hall today, and we hope that you will stay and join our support groups, which will begin at 3 o'clock today. On behalf of the Aplastic Anemia and MDS International Foundation, I'd like to thank you for joining us today, making us your resource of choice for information on bone marrow failure diseases. On behalf of our medical advisory board and team, we're always here to support you and your family, as we've done for the past 38 years. This concludes our session. Thank you so much, Jane.
My pleasure. Thank you.